Thank you so much for joining our ClinicSource webinar today regarding CS billing. We're really excited to have everybody joining the call today, and this is our first ClinicSource webinar that we have brought you in a really, really long time. So again, very excited to have you all joining today. So today's session is learn about our comprehensive billing solution, which is CSBilling or ClinicSource Billing, and obviously a new expanded service into the ClinicSource arena. So again, very, very excited to be bringing this offering to all of our ClinicSource family today. So some of the topics that we're going to cover today, we're going to have you meet our some of the CS Billing team. We're going to talk what is CS Billing or ClinicSource Billing. What is included with CS Billing? Are there any exclusions into this service? And then we're going to talk a little bit more about one-on-one financial health check with your office or one-on-one consultation with you about CS Billing. So my name is Kelly Trentacosti. I am your presenter today. I am the RCM Product Manager for IPS and ClinicSource. I have been with the organization for about 9 years now. And prior to my life here, I have about 35 years experience in multiple different capacities in facility, institutional, outpatient, private practice billing operations, and also the third-party consulting arena. I have a very strong background in pain management and the therapy disciplines. I have worked with hundreds of offices within our IPS umbrella with RCM solutions and best practice implementations in Matrix. So again, I'm looking forward to talking to all of you today, as well as one-on-one discussions with all of our ClinicSource folks. So now we're going to kind of jump in a little bit I wanted to introduce a couple of our RCM management team members on the CS billing side. So I've outlined here for you just very small bios for Jelaine Scott. She is our Senior Director of RCM, and Jelaine has 38 years plus experience in the RCM world, and again, many, many different capacities, as well as Megan Guess, who has been with IPS for many, many years. And she also has over 16 years experience in RCM. And she's an expert in payer guidelines and really passionate about helping customers achieve higher reimbursement. She's also worked very closely with many of our IPS billing clients throughout the years. So what is CS billing? CS billing that you've been hearing this big buzz about and getting a lot of communication. Again, CS billing stands for ClinicSource Billing. This is an integrated billing solution that we have brought to you that puts expertise of our RCM management team at your service. This is an internal billing solution. So this is already partnered with your software. This is not a third-party billing company. Very important for you because that makes this a very turnkey operation for you. Everybody being part of the organization, everybody having a comprehensive understanding of your software. Very, very key components to being successful. It's designed to maximize practice revenue. They ensure a lot of things for you. ACR claim submission, ensuring that we get timely reimbursements back from your payers. Appropriate ledger reconciliation, which is super important. Timely posting of insurance remittance advices back to your system, as well as robust follow-up on claim rejections and denials. And we also have a component to this program that you can enroll with that will allow us to handle your patient statementing as well as customer servicing on any of your patient side of the equation. So it is a very robust, comprehensive billing solution that we have brought to you. I just want to kind of give you a little bit of history here on why this is an added value service for your practice. And let me just emphasize that we expanded our billing solutions for the ClinicSource because of your requests. We had many, many end users and partners on the ClinicSource platform calling in and asking us, you know, we really need help with billing. And there's a variety of reasons why you might need help with your billing. A lot of things, what I'm hearing is internal time restrictions. You just simply don't have the time to treat patients and handle billing. So wearing a lot of different hats in the practice, the ability to scale with the practice growth that you're seeing in your different specialties. Some clients have voiced, concerns with current performance that they were seeing related to the billing, or internal staffing concerns that they had. Calling in and asking, hey, can you guys create a solution for us? And also looking for a cost-effective option that provides you a team of subject matter experts. So, when I say a team, I really mean when you sign up with CSBilling, you are getting a team of individuals. So you're going to have a biller, and you're going to have a poster, and you're going to have a main insurance account representative handling your denials, appeals, and potentially a customer service individual as well. And these are usually, the way this is set up would be impossible in many times for an office to have a staff of 4 people to handle their billing. So again, this is a result of requests coming in from our ClinicSource family asking us for help related to the billing. We've been listening, folks, so that's why we're bringing this to you today. So talking a little bit about the features and the benefits of CSBilling, this is designed to improve billing efficiency and patient retention by partnering with the experts. Again, keeping it internal, keeping this centralized, one-stop shop. Everybody is familiar with your software. Everybody is familiar with your discipline. Easily resolving and reconciling your insurance AR and eliminating the insurance follow-up time and headaches. And I think we all can relate to how much time it really takes sometimes to ensure that the claims that we're billing are actually processed and paid by the carriers, posted to our systems for accurate ledgers, etc. Eliminating interruptions from staff turnover, vacation, sick time, or even more than that, just internal time, because you're wearing so many different hats in the facility. Lowering your costs and saving time on your training, and driving financial performance through comprehensive analytics. So one of the great things about keeping this in-house with your software vendor and allowing us to handle your billing is, again, we're going to be providing you analytics directly out of your software database that are going to let you know exactly how you're performing, or if we're seeing any concerns or trends related to the billing that we're handling on behalf of your practice. I have included a slide here to talk to you a little bit overview of the CSBilling inclusions, or what is included in your service. So again, we are handling your EDI billing as well as any paper billing you may have, posting a ledger reconciliation right back in the ClinicSource. Everything is real time. Robust insurance follow-up, denials, and appeal processing, as well as that option to incorporate patient statement and customer servicing. So very robust. Once you have those charges into your system and an invoice has been created, the team is going to take over, and there is a lot of communication back and forth between the CSBilling team and your office. So this isn't an out of sight, out of mind. We like you engaged. The team is going to be meeting with you very routinely and going through analytics, making sure the best practices are being met. So this is really very much a partner relationship versus hiring an outside vendor. Some of the things that the CSBilling currently is not going to handle for you, meaning that these things would be retained internally within your practice. You're going to continue to code your claims appending those CPT and diagnosis codes. There's no abstract coding from your medical notes. Provider profiles and fee schedules within ClinicSource, that is retained in your office, as well as authorizations and insurance verification. Those things will retain an internal function. They are not handled by the CSBilling team. So is CSBilling a good fit for your office? So that's a question, everybody on the call, I'd like you to ask yourself that today. So one of the things that we are offering all of our practices is a free, no obligation consultation and financial health check. This is a personal review. It'll be with myself, and we're going to talk a little bit more about CSBilling, answer any direct questions that you may have regarding whether or not the solution is a good fit for your practice. We can also do a financial health check, meaning that we will run a series of analytical reports out of your system. I will review those. I will provide you with a very comprehensive overview of how you are currently operating compared to the best practice matrix that we recommend for your practice. At that time, we can also talk about the specific cost associated with this comprehensive solution. We at CSBilling, this is very customized for your office. So it's very difficult for me, without knowing how your office has been performing or how much you're billing and collecting, for me to quote a specific cost over the phone today. I can tell you that we charge you based on collections that are coming back. But it is, again, specific to your office, and we use a sliding scale to determine that. So I would encourage everybody on this call today to schedule a financial health check or a consultation with me one-on-one. And I did include here for you, what ClinicSource clients are saying. So I have had the blessed opportunity to talk to many practices over the course of the last few weeks since we rolled this out. And I have thoroughly enjoyed every moment of it. And this is one of those testimonials. So the CSBilling Financial Health Check provided insightful information on how the business side is running. Information that was shared ultimately helped us to decide to move forward with CSBilling. We are excited to hear about opportunities for increasing our revenue, the tracking and reporting capabilities of CSBilling, and having access to experts and best practice matrix. Thought I would share that with everybody here today. So this is a really good opportunity for each of you to take advantage of that today. So if anybody wants to take down my information, this is my direct information. Maybe a financial health check or consultation isn't something that you want to have now, but it maybe in the future would be great for you. So this is my direct contact information. The 414 is my cell phone, and I am obviously available to all of you at any time that you need to reach me.
So Ellen is asking again about pricing, asking, is it a range, or can you give an idea of what the cost is?
Sure.
I don't know if that's anything you can do, very generally speaking, Kelly.
Well, yeah, this is it's office specific, but yes, a good question. It is a range. There is a percentage range. The percentage range can go anywhere, from 9% down to 4%. It really just depends where your office falls. And of course, there is an associated minimum involved with that. So I would encourage you to spend a little bit of time with me, and then we can pinpoint that exact cost for you. What we normally find is that this is much more cost effective than doing it internally. That is generally what we find. And again, you're getting that team of individuals that are going to be working on your accounts, because this is very production line based.
Mm-hmm. Thanks for that. If we have time, Kelly, I do have some other questions that came through, so I'm just going to keep asking you until we run out of time here. So John is asking if you can bill Medicaid and all the CMOs.
Yes, our team is very familiar with Medicaid and all the CMO arrangements in the different states, so we can handle all of that billing with Medicaid, any of you who are doing Medicare, and of course all your straight commercial payers as well.
Thank you for that. Shonda is asking if there is a contract.
There is a contract through CSBilling. It is a standard 12-month contract. And again, that's pretty standard. There are some organizations out there that are doing, I've seen, month-to-month contracts. That is normally a relationship I would consult with people and tell them to avoid, because we're in it for the long success of your billing. So it's a 12-month contract through CS. And and I did see a question about related to that come through, if we do credentialing. And unfortunately, we do not do credentialing. However, We do have some credentialing partners that we have worked with in the past. So again, take my information and I'm happy to share that with you.
Thank you. Emma is asking if CSBilling would take over as the new billing team, or if you would work with the current billing team who is at the practice.
Okay, so CSBilling, again, is set up to alleviate your internal headaches and costs related to doing the billing. But I will tell you this, CSBilling is handling all of your new claims and forward. So we don't go back on outstanding accounts receivable, but we have worked with offices where their team is handling some of that older stuff, and then our team is handling the new dates going forward.
Okay, thank you. I'm seeing a couple questions about clearinghouses. If one is needed, if we have to use one through ClinicSource. Is that something you can address, Kelly?
I sure can. So CSBilling does integrate with CSClear, which is the new integrated clearinghouse hosted through TriZetto. I know that we have a lot of users within ClinicSource that are using Availity or Office Ally. I will tell you, we don't work with those clearinghouses. There's a reason for that. We don't find that they are as robust or have the integrated process that we're looking for. So again, that is something that we will discuss on our one-on-one, but you are required to enroll with CSClear, which is the new integrated clearinghouse product through ClinicSource.
Thank you. Okay, Ellen is asking if there are some insurances that you do not bill, or do you take over all the insurances that I guess the practices currently takes? And then there's a follow-up to that asking if we take or if they don't enter EOBs.
Okay, so our team is going to be handling any of the billing that you assign to us. So generally when I meet with you and I will have a series of reports out of your system, we will go through the different carriers. Normally we take everything. The only reason that there would be something we wouldn't take is I have talked to some offices who have kind of an accounts payable through a community plan where they're providing services, and that's again handled as kind of an accounts payable with the office. But we handle all of your insurance and government. I even have some practices who handle auto or work comp, personal injury cases, so we handle that as well. So there really isn't anything that we won't handle for you. And what was part 2 to that, Bonnie? I'm sorry.
Let's see, asking about EOBs.
The answer is yes. Our team, the minute that you go live with the CSBilling team, all of the remittances from that day forward will be the responsibility of the billing team, and they will be posting those EOBs back into ClinicSource. Again, everything real time, making sure that there's a good, solid ledger reconciliation. So whatever the payer says is a patient adjudication, that is reflected accordingly. And they are also going to handle any zero pays that come through in terms of denials that require follow-up with the payer and or appeals. That is also handled by the billing team. One of the really great things about this relationship with CSBilling is that, again, I talked about communication, right? And one of the things I have seen throughout the years of doing this is that when practices are engaged with somebody else handling their billing, the fear is, I'm not going to know about denials timely. We see these people 2 and 3 times a week. If something goes awry, I need to know about it. And that is exactly some of the foundation that we built the CSBilling around. We understand how important that is. That is why you get a weekly report from your billing team. They're going to be meeting with you weekly to start, then every other week when you're comfortable, and then you will get into a rhythm of routine monthly meetings or something like that. So we understand that this is your practice. We try to cater this exactly how you want things done, but we have established protocols that make make sure that you are very much in the know of exactly what is going on at all times. And that is really, really important, that everybody is aware. So if there's an eligibility issue, if there's a authorization issue, you guys need to know about that stuff right away. So that's why the communication is so solid. I'm really, really looking forward to those of you who indicated that you did want outreach from me. I will be in contact with you soon, and we'll get you on my calendar, and looking really forward to having a good conversation with you.
Perfect.
Thanks everybody for attending today. We so appreciate it, and we are really over the moon to be able to bring this service to you finally, after you've all been requesting it for so very long. So have a great day, and I'll talk to you soon.
Thanks, Kelly. Bye.